general assistance medical care. The governor's action means that 33,000 of Minnesota's poorest, most vulnerable people will lose health care coverage. Tragically, these are our veterans, our senior citizens, our homeless, our families and neighbors with mental illness. Most of these recipients live on $203 a month. Nurses, we know these people, don't we? Stroke of a pen forgets the humanity. I'm asking all of you, can we allow Governor Pawlenty to get away with this?
No!
The rest of the nation is debating how to be inclusive of health care for all. Our absentee governor in Minnesota is choosing to eliminate health care for our most vulnerable citizens. In Minnesota, we expect a humane approach to budget balancing. Nursing in Minnesota will not stand by and be silent, will we? We also want to let the governor know that his idea of states' rights to cheat Minnesota out of any gains in federal health care reform, if we should get it, would deny additional thousands of people access to affordable health care. This is mean-spirited, unacceptable, unethical. It's not the Minnesota way. Governor Pawlenty, we can't let your political ambitions hurt our Minnesotans. I'm asking all of you, can we allow Governor Pawlenty to get away with this? The nurses and people of Minnesota are here to tell you, Governor Pawlenty, stop standing between nurses and our patients. Give Stop standing between nurses and patients and give them access to the care we want to give them. Number two, come back to Minnesota and work with us to solve this crisis. Come back! Number three, support meaningful federal reform efforts. And number four, fully restore GAMC and do this by
My name is Stephanie Wells. I'm an RN at HCMC and have worked there since 1974. In my work, both in the walk-in clinic and the medical ICU, I take care of many patients who are on general assistance. It is a lifeline for my patients. The governor's cuts are devastating and will have dire consequences for my patients, for my institution, HCMC itself, which is one of the only level 1 trauma centers in this area, and for my ability as a nurse to provide the best care that I can. I'd like to share a couple of stories with you that happened to me in my practice. One patient I recently saw in the medicine clinic was a 55-year-old single female who had lost her health insurance due to her losing her job. She had high blood pressure and had not taken her meds for 3 months. The reason she hadn't taken them is because she didn't have any money to pay. When I asked her about that, she put her head down, and I will never, ever forget the look in her eyes. I saw tears starting to come, and she said, I have never, ever had to ask for help before, but I knew that I needed to now so I could take care of myself. GAMC was there for her. Another is a young man with a disabling condition known as psoriasis. You might not think of this condition as a disability, but if left untreated, a severe case can lead to joint and organ damage that would cause him to become disabled completely by the time he was 40. He is a carpenter and is unable to wear the equipment required of him as a condition of employment because all of his body bleeds when he showers. All he wanted was to be able to get the medicine necessary to treat this condition so he could again become a productive member of society. GAMC has provided him with this opportunity. What good would it do to deny this? The cost of eliminating GAMC will mean that more people will need ICU treatment for conditions that could be controlled with a primary care provider and proper medications.
Yes.
These ICU visits cost a couple of $100,000 as opposed to the price of clinic visits and simple medication. I see this in the ICU there all the time. Massive strokes due to not enough money to pay for antihypertensive medications, prolonged ICU stays because patients have not taken their medicine for asthma, a simple inhaler in many cases. Many people on GAMC, and you've heard this today, have chronic medical conditions that affect their ability to work at jobs that pay enough. They didn't ask for these diseases. No one would want to be diagnosed as bipolar or schizophrenic. Any one of us at any given time could have ourselves or a loved one diagnosed with either one of these conditions, which so hurt the quality of life and which affect indirectly countless others every day. This is heartbreaking, and you all know this, you've all seen this. It's heartbreaking to encounter, and yet I see it every day, and I know you other nurses do too. When we choose not to take care of the poorest among us, it hurts us all. We are calling on our governor to come back to Minnesota to help us solve this crisis. And make no mistake, if we do not stand together against the cuts to GAMC, if we do not defend this, then the next round of cuts may be to a program that benefits you. Thank you, thank you.
Hey, how you doing?
Hi, good. Nurses would like to talk with somebody, preferably the governor. Is he here? Not here. Who can we speak with?
I will be happy to take it.
All right, we have a few demands, and in case you can't read them, we'd like to give him the demands of, go ahead, they're in the
Stop standing between nurses and their patients. Come back to Minnesota and solve the GMAC crisis. Support meaningful federal health care reform and restore GMAC by raising revenues. We need this for the poorest of poor. It is right and it is what we need in this state to be caring Minnesotans like we always have been, Minnesotans.
Time for him to come home so we can work on this crisis he's created. We don't want to see it falling apart in the spring. We want to deal with it now so we don't have our vulnerable getting sicker and dying because of his stroke of the pen. We're serious. We're on board. Thank you. We'll leave you our message.
Yes.
Thank you. Please do. Thank you.
Thank you.
Yes. Anything to say? No? Okay. Thank you. Thank you.
Thank you.